The occlusal plane. Teeth erupt to meet their antagonist in the opposite arch. Occlusion follows the curved line from anterior to posterior. This curved line is called the curve of Spee. In the transverse, the occlusal curve that goes from left to right when viewed from the posterior is called the curve of Wilson. The sphere of Monson is seen on the lower left. The cusp tips appear to be resting on a sphere. When you view the curve of Spee and Wilson simultaneously, it produces what we call the sphere of Monson. Lateral excursions are movements of the jaw from right to left. The side to which the mandible is moving is called the working side. The opposite side is also known as the non-working or balancing side. When performing lateral excursions, the canines carry the bulk of the contact and should be the last teeth to touch in a lateral excursion. The canine rise opens the bite by gliding down the lingual surface of the maxillary canine. When the premolars also participate in a working excursion, it is termed group function. Non-working cusps rarely touch in a natural dentition. If they did, it would be harmful to the TMJ. When the mouth closes, all posterior teeth should contact at the same time. When one tooth hits before the others, it is called a premature contact. If the anterior teeth touch in centric occlusion, it is called anterior coupling. Fundamental and preventative curvatures. Teeth have curvatures that disperse occlusal forces and protect the periodontium. They prevent disease, bacterial colonization, and calculus adherence. Proximal contact areas prevent the food from packing between the teeth and give support and resistance to displacement from occlusal forces. Interproximal spaces are triangular-shaped spaces between the teeth. They provide space for the bulk of bone to anchor the teeth. They are formed by the bone and the proximal surfaces of the teeth and are filled in by the interdental papilla. Embrasures are the spaces between the teeth above the contact area. They allow for passage of food around the teeth so that food is not forced into the contact areas. They dissipate occlusal forces and are self-cleansing. Contact areas. The contacts in anterior teeth are located close to the incisal edge. On posterior teeth, the contacts are in the middle third of the tooth. Occlusally, anterior contact areas are centered between the labial and lingual surfaces. Posterior contacts are slightly buccal to the center of the teeth. Lingual embrasures are wider than facial embrasures. Facial and lingual curvatures permit the proper deflection of food during chewing and allow for cleaning by the tongue, the buccal mucosa, and the lips. The buccal height of contour is in the cervical third of the tooth. The lingual height of contour is at the cervical third in the anterior teeth and in the middle third of the posterior teeth. The curvature at the CEJ. The anterior teeth have a greater curvature at the CEJ than the posterior teeth. Anterior teeth are narrower labiolingually and need more interdental bone for anchorage. The mesial curvature is usually greater than the distal. Mandibular teeth have less curvature than maxillary teeth. The self-cleaning qualities of the tooth include a smooth enamel, the shape of the tooth which deflects food onto the gingiva at the proper angle, and fissures which dissipate occlusal forces and act as spillways for the food. Tooth contours deflect food off of the tooth onto the gingiva. If a curvature is too extreme, the gingival tissues will not be stimulated. Gingiva will not be cleaned and bacteria not removed. Open contacts between teeth allow food to pack between them. Large spaces, such as diastemas, will allow food to be washed away.